Hello everyone, I am Professor Sibani Mazumder, Professor and Head of the JANM Medical College and ex-Professor and Head of the Calcutta National Medical College in the Department of Anatomy. Now today I shall show you how you will identify the specimen of the diaphragm and how will you hold it in anatomical position and recognize the different orifices.
Hello everyone, I am Erito, MBBS student from Calcutta National Medical College and Hospital.
Now you tell me what is the name of this specimen.
So it is the musculo-aponeurotic diaphragm.
Good. What is the meaning of the diaphragm?
So dia means two and phragma means partition. So diaphragm means actually partition.
Partition between two main cavities.
Yes.
That is the thorax above and the abdomen below. So this is the thoracic side and this is the abdominal side.
Yes.
Good. How will you identify which one is the thoracic side or superior surface?
The thoracic side of the diaphragm is actually characterized by the presence of fibrous pericardium. As we can see here, it is the fibrous pericardium in relation to
why these two things are attached together, the central tendon and the fibrous pericardium?
So in order to accommodate the heart properly and so that when the diaphragm is contracted or relaxed, so it will actually
so you have to say first, that is in one word, that the both of them, fibrous pericardium and the central tendon, develop from the same origin.
Yes.
That is the septum transverse.
Septum transverse.
Okay.
Yes, ma'am.
Good. You show me the major openings of the diaphragm.
So the major openings in relation to the diaphragm as follows. So we can see at the junction of the right and the central leaflet, we can see the opening of the vena cava opening at the level of the T8.
Now what structure passes through the vena cava opening?
So inferior vena cava.
So inferior, which carries blood from?
So it carries blood from the systemic circulation to the heart.
That systemic circulation that lies below the diaphragm.
Yes, ma'am.
That is from lower limb, abdomen, is all the things.
Yes.
So this is the inferior vena cava. Now what is the effect of contraction of the diaphragm on this vena cava opening?
So actually if we see carefully, this vena cava opening is actually quadrilateral in shape. But when this diaphragm gets contracted, it will be dilated.
This is the muscular portion. So
yes.
When it is contracted, this is dilated.
Yes, it is dilated. So it will promote the increased venous return to the heart.
Good. Show me the esophageal opening.
So if we observe carefully,
you hold it in anatomical position, then you will show me the different opening at the different level. So I show you. So you will see the esophageal opening. This is the esophageal opening.
Yes.
Actually there is the presence of esophagus. That's why the opening is blocked by the esophagus.
Yes, ma'am.
Yes. At which level this opening lies?
T10.
That means thoracic, 10th thoracic vertebra. And within which structure it lies? Which part of the diaphragm it lies? That is the muscular part of the diaphragm.
It lies.
So what is the effect of contraction over this esophageal opening?
So it will be actually dilated, and
how it is dilated? Because it is within the muscular part.
Yes.
The muscles are contracted. Yes. And there is the fibers from the right crus encircle this opening.
Yes, ma'am.
So there is constriction of the esophageal opening.
So it is working like a sphincter.
It's working as a sphincter.
Yes.
Good. Now you show me the aortic opening of the diaphragm.
So in between these two crura, I can appreciate the aortic opening. It is the aortic opening.
The two crura, where from it arises?
So it arises. So it is from the vertebra, from the T12 vertebra.
it arises on the right side. You see the right side, it is more thicker.
Yes.
It arises from the L1, L2, L3 in the right side.
Yes.
And here it arises from the only L1 and L2. Partly it is torn away.
Yes.
So in between, see, you will see this ligament is the median arcuate ligament
Yes, ma'am.
and is encircle this.
Yes.
So the effect of contraction of the diaphragm, there is no effect over the
Opening of
aortic
the-
opening.
Yes.
Good. So you show in the front to the others the actually the crura. You show the crura.
So it is the right crura. And
So you will see the crura. You will facing in this way. These are the crura. This is the right side and left side. It is on the opposite side.
yes.
And you will see this is the aortic
Aortic
opening.
opening.
So these are the different openings of the diaphragm.
Yes.
Now what is the applied anatomy of the diaphragm or the clinical anatomy?
So if the diaphragm is deficit in the fibers, it can give rise to the diaphragmatic hernia, and it,
Good. You will see that there are different origin of the diaphragm.
yes.
If some of the fibers there is not arises from the ribs or from the arcuate ligament, there is a big gap,
Yes.
and this big gap is known as area of Bogdalek,
Yes.
through which this is a very big hernia. Whole stomach can go into the chest after taking the meal,
Yes.
and the patient feel respiratory difficulty. Now, what are the other types of hernia you will see here? You will see around the esophagus there is the opening. So, if this opening become loose and lax, if the musculature is lax, then the person suffer from paraesophageal hernia, which is common in most of the person who get pain after the meal, small amount of pain. So they have to actually regulate the food habit.
Yes.
They have to take plenty of meal in the frequent manner. Not plenty, scanty meal in frequent manner. So what is the nerve supply of the diaphragm?
So right and the left phrenic nerve.
Right and the left phrenic nerve. Which type of muscle it is? That means what type of respiration it produces.
So it actually helps in inspiration.
Helps in inspiration. And in case of children, the diaphragm moves more.
Yes.
So in case of child, the respiration is abdominal.
Abdominal.
So thank you everyone. I think all of you can enjoy this specimen.